COVID-19 crisis, a lot of the attention is rightly on what drugs we will have. Will we get a new drug that allows us to treat this disease? But a just as important question is on what terms are people going to be able to access this drug? And to understand the terms by which people are able to access this drug, we have to look at countries' national patent systems. What a lot of my research has been about is sort of looking at when this big change came about in the 1980s and 90s that required countries to give patents on drugs. It's something that they never did before, and they still probably wouldn't do if it weren't for changes in the international trading rules. And when this big external shock hit countries and they all had to put patents on drugs, they went about doing so very differently. So a lot of my research has been about trying to explain this variation between countries in Latin America in the context of this one overarching external obligation to grant patents on drugs. This becomes super relevant in what we're looking at now with COVID-19, because one of the things that we clearly are desperate for are drugs. We're desperate for vaccines that can basically make people immune to the virus. And issues of patents are going to become very relevant here. Some drugs that we might use are older drugs. They're there for one purpose, and some firm or some researcher thinks it could actually be useful against COVID-19 as well. Now, many of these are older drugs, but once they get approved for a use, someone's going to try to get a patent on the new use, a use of this drug for COVID-19. One of the ways that countries' patent systems differ greatly is that in a country like Mexico, you could probably get a patent on a new use of an existing drug. If you try to get a patent on a new use of an existing drug in Argentina, it will not be granted. It will be refused. But there's a way in which sort of differences in countries' pharmaceutical patent systems might matter. There's also drugs that we're looking at now that are drugs that, for example, the one that's getting the most amount of attention is a drug called remdesivir, which is a drug that was developed for Ebola, and there's some thinking that it might be useful for COVID-19. That drug has patents. That drug has patents all over the place because that's a fairly new drug. So if that drug gets approved and that becomes sort of the treatment of choice or the global treatment out there, we're going to have a serious issue in that drug is going to be patented in most countries. We can wait and see whether that one global supplier makes the drug massively available for billions of people on the planet Earth and makes it at a low price, or countries might take matters into their own hands and they might try to get that firm to lower the price or just allow somebody else to issue the drug, to produce the drug, even though it has a patent. This is called a compulsory license. And here we see incredible amount of variation between countries. If the Brazilian government were to try to issue a compulsory license against a drug like remdesivir, it probably would be able to. And the reason why it would be able to is that Brazil changed its patent law in the early 2000s to make it easier to issue compulsory licenses. That's why Brazil was able to get the price of antiretroviral drugs for HIV/AIDS down in the 2000s. Again, the contrast with Mexico is useful. Mexico has a very rigid compulsory licensing rule. If the Mexican government were to threaten a firm with a compulsory license, the firm would probably laugh because it's such a hard rule, hard law to use. So again, variation in the country's systems have serious implications for how well countries will gain and retain access to essential medicines for COVID-19 when they emerge. So one of the steps that countries could do now is review what their laws say about issuing compulsory licenses and seeing if they have a compulsory licensing regulation that's essentially easy to use or hard to use. And if it's easy to use, consider using it. And if it's hard to use, consider reforming it to make it easier to use.